Lindsey Williams is the acting director at HLI, Human Longevity Inc. We like to start with that big picture question, that sort of why question. So when you think about HLI, what's the big moonshot size question, the problem that HLI is addressing?
Yeah, I think the goal at HLI is really to shift the paradigm in healthcare from a sick care to a well care and really reduce preventative medicine and personalized medicine to practice.
You know, I don't know, what does that look like? I've heard people talk about, you know, sick care versus health care, and I think it's a very interesting and important phrase to use. It kind of stops people in their tracks, you know? It kind of stops them. And I don't know, why do you think that's important to identify?
Well, I think in this example, you know, we traditionally treat patients once symptoms have become apparent, right? When you know you have a disease. But the goal really is to move to pre-symptomatic diagnostics, where you would know a decade or more before the onset of a disease and would be able to take measures to prevent that disease.
Okay. So HLI trying to help me understand what's going to happen to me 10 years from now. Now walk us through what it actually does. What does Human Longevity Inc., has it built?
Yes, so we have an amazing assessment called the Health Nucleus.
The Health Nucleus, okay.
Yes, and what the Health Nucleus does is it's a comprehensive state-of-the-art assessment at our facility in San Diego, California. And effectively what that does is whole genome sequencing, whole body MRI, and a battery of other types of blood-based testing that is integrated using our mediated AI platform. And integrated by our physicians to identify health insights that can impact your health and your longevity.
So a really awesome body scanner.
Yes.
Do I ride into it like an MRI, or do I like walk into a room and have it scan me?
Listen, you have to come see it. It's amazing.
I think I've seen a picture. It's pretty impressive.
It is very
impressive. Blue
impressive.
lights, very futuristic.
Yes, our facility is unparalleled for sure.
So I come in and I get a scan. It's comprehensive MRI plus all of this genomic testing. Okay, so what do I get back?
So you get an integrated health report, and that I think is really what's fantastic about what we offer. Really being able to utilize all of the technology, machine learning, all of this AI, all the fun buzzwords, right?
All in one awesome
All in one
test.
awesome place. And I think the important thing is that we are doing this in a way that's actually actionable for you as a patient, right? And I think that gives you insights about your own health and allows you to make decisions proactively about your own health care that can impact your longevity and ultimately help people not just to live longer, but to live healthier longer.
Can you think of any examples of kind of a reading that I would get back that's like extremely actionable now? Like kind of life changes I might make?
I'll use my own.
Oh, you've done one?
I've done one.
Okay.
Yes, and not to put it out there, but I guess we'll go there. I actually have a heterozygous variant for ApoE4, which is really a hot topic right now because it increases my risk of Alzheimer's disease when I get older. So obviously right now, right, there's, one would say, well, what do you do, for that? But there's more and more research now that's showing that you can reduce your risk by taking specific, changes in your lifestyle and diet. So I now am empowered as a patient to not only know my specific disease risk, but make specific changes and choices in my lifestyle to address and reduce my risk long term.
And I'm guessing that you have.
I have.
You saw the numbers and it was actionable for you.
And I will continue to stay on top of the research that comes out about ApoE4 and about Alzheimer's to make sure that I'm always at the forefront of knowing how I can continue to reduce my risk long term. Interesting.
Okay, so HLI built this awesome test, giving actionable data. Where is it at right now, coming into 2020? Like, kind of what are the big hallmark things that we should be looking for from HLI that you're excited about?
Yeah, I'm excited about really expanding our commercial operations. I think we are working on some strategic partnerships that we are going to be looking forward to announcing later in 2020, and I think it's really going to be a banner year for focusing on not just the expansion of our availability. I think we've made a lot of changes in the Health Nucleus facility that are going to allow for more capacity, which is amazing. So we'll be able able to help more people, but also just from an expanded commercial and focus perspective that really we're putting ourselves in the market and we are making this available to patients.
Yeah, I mean that device seems incredibly useful. What's the vision in terms of accessibility to it?
Yeah, accessibility is definitely something I think that from a long-term perspective, really looking at healthcare as a whole and understanding that there is a massive transformation that has to happen to truly move from sick care to well care, but that we're at the tip of the spear, and that's an exciting place to be. So we're looking forward to leading the charge.
Nice, awesome. All right, that's all the time we have. Thanks so much for coming by,
for having
Lindsey.
me.
And I can't wait to see what HLI does next.
Absolutely,
All right,
thank you.
All right, take care.